the information that we collect around patient experience, around concerns, around clinical incidents, around clinical audit, is all collected centrally within our governance and quality team. We're able then to really effectively triangulate those experience themes and understand where we're at, know how we're doing, and able to then pinpoint very quickly areas where we need to tackle and areas where we need to make improvement very quickly.
And particularly I'm interested in how we use carer feedback from families with long-term conditions, care at home, to actually how we can improve the life for carers who are looking after people with quite severe sort of complex conditions in the community. So what other things could we do in terms of gaining support for them from other agencies, as well as not just the NHS input as well.
Over the next few years we're going to need a lot of new ways of doing things, new ways of thinking, new ideas, and the patient feature zone is a really good way of disseminating that. So we can go along there, see the ideas of other organisations and share with them the things that we're doing.
So we need to have a positive domino effect of patients who can want to do more using technology, using apps, etc. around the healthcare, which then has a positive domino effect around healthcare advisors and nurses, the voluntary sector being able to do much more, and integrating that into primary care, and then really just using hospitals as very short stay, short intervention places where patients get the necessary kind of engineering done and then just promptly discharged back to care. So I'm completely sold on that idea.
The benefit of our project was we've got patients and their families live long distances away, and we were finding that they were having to spend long times travelling. They were the expense of travelling, plus not all jobs are as secure as we like at the moment, so people were having to take time off work to visit, maybe from London, from the Isle of Man, from Wales. So the beauty of our project was that patients are now able to FaceTime using the Apple facility, FaceTime their relatives and have a conversation with them at a time of their own choosing. So it made them feel as though that the families were closer to them, so it made their stay in hospital, in some cases, in one patient's case, shorter, and it made it, if you could say, more enjoyable, a more enjoyable experience.
Generally, I think conferences do two things generally. One, it's a really good opportunity three things really. One, it's a really good opportunity to actually learn new things, which is what we've just talked about. Secondly, there's an opportunity to get some reassurance that you're actually doing the right things and you're moving in the right direction. And thirdly, it's a great opportunity to network and have the type of conversations we've just had. I sometimes think the NHS, because of the sort of semi-competitive environment, is a bit closed and doesn't want to share some good ideas, and I think these are really good opportunities to make sure that we use public money effectively and share learning and good practice across the country.